This conference will now be recorded.
Hello, people, welcome to class. So today I'll be just doing a small class because I have getting request for explanation of this MEOWS and NEOWS chart. Okay, so I'll be explaining that. So now, what is this? So this is the MEOWS chart. So MEOWS chart is modified early obstetric warning score, and obstetric modified early warning score chart. Why we are using it? It is used for all women undergoing observation, so that early recognition of the can be done before they become critically ill. So this is sort of a scoring. On the basis of that score, we'll be able to identify that how much how like frequency of observation is required, or whether any immediate attention is required, so before the critically patient becomes critically ill. And it is same for obstetrics, and it is different because the physiological changes that occurs in the pregnancy. Because of that, these ranges are different. Because of that, when it is for obstetric, then it is either MEOWS chart or MEOWS chart. But if it is for any other adult, then it is NEOWS chart. So we are doing two subjects. When we are doing obstetric patients, we are using this, and when we are dealing with the gynecology patient, then we are using news chart. And I'll be explaining both in a simple way how it is required for your exams. So this is the MEOWS chart. Now what parameter they are using? They are using respiratory rate, they are using oxygen saturation. Now oxygen saturation will not be there in the community. Okay, so temperature, systolic blood pressure, heart rate, and a level of consciousness with the AVPU scale. And this is AVPU scale. A is alert, V is voice, that means the patient is responding to voice. P is pain, patient responds to pain. And U is patient not unresponsive to any voice or pain. Plus and minus urine output. Okay, so these are the MEOWS scores. Okay, now this is the MEOWS scoring pattern. So they have given the parameters, like if it is here, if your patient is here, then the score will be 0. So sometime it is white or sometime it is gray. So if the 0 is there, then patient is fine. Now these are the criterias where the score will be given 1. So this is the sort of yellow. um, for yellow they are giving score 1. And this is amber in color. Any parameter lying in amber color, they are giving the score 2. And any parameter lying in red color, they will give the score 3. So like for example, for the respiratory rate, now the respiratory rate, if it is 8 to 14, it will come in 0. So we are happy, no problem. And if it is coming in less than 8, then it will give red score. It will be in the red line, or the score will be 3. Now if we move this kind, if it is 15 to 20, it is yellow. And if it is 21 to 30, then also then it comes amber. And if it is more than 30, then it will come red in color. So respiration high or respiration less than 8, both the is not good. So they have put the score 3. Similarly, for the oxygen saturation, if we already know it, if it is more than 94 and above, we are happy. So it is score 0. Now if it is 90 to 94, they will put yellow, that means score 1. If it is 85 to 89, it will score 2. And if it is less than 85, it will be score 3. So this way, but scoring is done. Now this will come to temperature. So if any patient has got temperature this, it is fine. If it is 35 to 39.9, then it is yellow score. But if it is high temperature like 38, 39, then the score 2. And more than 39, score 3. Similarly, it comes for systolic blood pressure. This is for the systolic blood pressure. Similarly, it comes for the heart rate. And similarly it comes for the urine output. Urine output less than 10 ml will be red, and urine output at 10 to 20 will be red, will be amber in color. So this way the MEOWS scoring parameters are done, but it is just for your understanding. In the exam nobody is asking you this. In the exam you will be given a chart, and you will be given a patient scenario. Either you are doing part 2 or part 3 any exam, so you have to do the interpretation. So it is important for the interpretation. Okay, so better understanding is required, then only you'll be able to do the thing well. Then these are the guidelines for filling MEOWS chart. So when the 0 score will be there, when the 1 score will be there, when the 2 score will be there, when the 3 score will be there. So okay, this is not too much required for you because you need not to fill it, so I'll be skipping this part. Now this part is important, that is the MEOWS escalation plan. Now they have put that in the three priority 1. So if the total score is 6 to 7, if the total MEOWS score is 6 to 7, then or um, all of a sudden there is a score 3 or one red box. One red box will give one score 3. So if any red box comes suddenly, or if the total score is 6 to 7, then hourly observation will be done. Then hourly observation can be done. But if any time more than 3, any parameter all of a sudden become red box there, then they will escalate it to priority 2. So a score of total MEOWS, if it is 6 to 7, it is fine, we will just review the patient early. But if all of a sudden red zone has come, or score rise of 3 has come, then escalation plan to the priority 2. Now priority 2 is 8 to 14. If the 8 to 14 is the score, then that means the patient is ill. So like the if it is patient usually outside, okay, like in community or somewhere, then they will contact a registrar consultant for advice, and should re-examine the patient. And patient they will keep on looking every half hours. Okay, every half hour they will be seeing. That means the patient is sick. And if one score again become more than 3 or red box, immediately it will become priority 3. And if the total mu is so high, that means 15 to 21, so that means this is some emergency catastrophe deterioration is going to happen. Patient has to be seen very urgently by registrar consultant, or ICU referral is required. And one only every 15 minute the patient will be seen by the attending people or attending staff, unless the patient is reviewed by the team doctor, or consultant or registrar. And so this is priority 3. So this is the escalation plan. So when the patient is admitted, and if the patient is ill, so the MEOWS monitoring will be done. According to this that the score calculation is done, and according to the score, then they will do the escalation. So what will be the what will happen with that? The patient, before she becomes totally ill, so the people who are attending the patient, they will escalate her priority. So before she deteriorates, she will be seen by consultant or some specialist, so that we'll be able to pick the patient early and treat the patient early. So this way the MEOWS happens. Now I would like to give you one example of MEOWS. So here is the patient. This patient she has come for the labor. Okay, she has come for the labor. So when she attended at 39 weeks 4 days, and that time these were her observation appears to be fine only. And she came with a rupture of membrane. Okay, then the induction was planned. So this is one scenario. So when the patient came, at the time when the patient came, so this kind of picture it was there. So you may find this kind of picture in the exam. Now you can see it from here, like respiratory. So it is 1 hour, this denotes 1 hour. So respiratory rate is going slowly high, and it is coming red zone. So now you can see the respiration. What is the trend of respiration rate? Respiration is rising. And if you see spo2 is like it is green. So it is like score 1, so it is fine only. If you see temperature, so temperature is gradually moving to score 2, okay, 2. So respiration is rising, and the temperature is also rising. So there are two things, and the patient admitted with the patient is admitted with what, with the for induction and with the rupture of membrane. Okay, now like during delivery, there had been a blood loss of this much, and these are the parameters. Now, in the exam, you will find this kind of MEOWS is given. So, what you have to see that sometime they will give you total score here. Here you will find a column where the total score will be there. So, you look from the total score here, and according to that, you will be able to find out whether your patient is an emergency patient, or whether the patient is like normal observations are required. For example, you can see it here. So this is heart rate. Heart rate has come in the gray. Here the heart rate is the red. Okay, this is heart rate red. This is heart rate red. So and here you can also see systolic blood pressure. So here it is coming yellow zone. So this way, like every hour, when when the patient will be reviewed, every hour all these parameter will be seen, and they will be put here according to the observations what is given. And then the total score is checked. So yellow will be 1, amber will be 2, and red will be 3. So the score calculation is done, and the person attending will calculate the score, and on the basis of score, then escalation of the patient care will be done. So this is our post delivery. Now day 2, the patient had jaundice and patient was in phototherapy. These are the day 3 vital of the patient. Day 4, her score become 8. Day 4, her score became 8. Now I want to show you the day 4 chart. Now this is the day 4 chart. Now if you see it here, so here the score is 8. Here the score is 8. Now how you will calculate? I'm calculating this. Okay, I'm calculating this. So here score is one is one has come in like red in color. So one red box. Now I'll follow this down. Another red. So there are two red boxes. Two red boxes score 3 plus 3. And if you see one yellow box, so this is one yellow box. Yellow box will be 2. So one yellow box score is 2. So now one red, two red, and one yellow. So 3 plus 3, two red boxes is 6, and one yellow box score is 2. So 3 plus 3 plus 2, it will be 8. So here the score is 8. Okay, so this way the scoring is done. So in the exam, you have to know how to look at the charts, or how to interpret do the interpretation. So this is a zoomed the form of same. Now you can see the MEOWS score. See, they have written the MEOWS score here. So here it was fine only first 4 hours, then it became 8. Then it is after 2 3 hours, it is again 8. That means if the score is 8, so the patient, according to the MEOWS escalation plan, it will be escalated. So 8 to 14, we saw the score was priority 2. So now the patient comes in priority 2. So it will be required to be seen by expert person, and according to that, the plan has to be changed accordingly. Okay, so this way you will get MEOWS in the exam. Now this is MEOWS score escalation. This is again, now if the 6 to 1 to 3 to 5 is there, then only 1 to 4 hourly has to be seen. But if the patient is more than like 6 to 8, if the score is 6 to 8, that means 1 to 2 hourly seen. An urgent call has to be sent to the maternity unit. If the score becomes more than 9, then emergency call. If it becomes more than 9, then emergency call has to be done. So this way, like only for you guys, you have to just know about these things, because in the exam you have to just do the interpretation only. And then you have to just see whether your patient is ill or not. Okay, So this is MEOWS. And is it clear about the MEOWS? Any question?
Yeah, it is clear.
Okay, now coming to the news is almost same. It is almost same, and in the news, but it is for the adult patients. So it will be used for non-pregnant patient. So whenever gynae patients are admitted, or they're ill, or some post-op patients are there, in that we'll do news charting. So news charting is a tool that helps in detection and response to clinical deterioration. Main thing that before the patient deteriorates, we have to pick it so that we will be able to manage the patient. Okay, so this is the new scoring. Okay, so white is score 0, yellow is 1, amber is 2, and red is 3. Okay, so like this way it is done. You need not to remember anything about this, just reading once will be okay. Then this is the we see our patients always with the ABCD approach, isn't it? So this is the new chart. So now AB first is respiration. So AB respiration, another is AB SpO2. So it is SpO2. So SpO2 will be scale 1 and scale 2. You will see scale 2 if it is for the ill patient, if it has been decided by the consultant. Otherwise, most of the time you will find AB plus SPO scale 1 only. So much details are not necessary. C will be the blood pressure. This C will be the pulse. D is the consciousness, that is AVPU score, and E is the temperature. And you can see here news total. Here the news total has been written. So in the exam, you may find score here, or you have to see red boxes or yellow boxes, or sometimes they show graphical trend. So this way you will find in the exam. So this is the new clinical risk threshold. Like if it is score of 3, no, if it is average score of 7, then it is urgent thing. So if whenever you see that one red has come all of a sudden, then the urgent response will be required. Average score 5 and 6, then also urgent response, but it is medium. And if the 7, if you find 7 score in post-op patients, usually you have to do urgent like emergency response. So you can just remember 5 to 6 you have to do urgent response. If it is 7, then you have to do emergency. Usually this is not required to be read. Just remember this only, so you'll be able to do the interpretation in your exam. Now again the same thing. So if it is 3 in single parameter, that means red score has come. Patient to be observed 1 hourly. If it is 5, then also 1 hourly. Urgent 5 or more than 5 urgent, 7 or more it is emergency. If you could remember these two things, it is enough for you. More than 5 C1, more than 7 continuous monitoring. So only remember this much, only remember this much for your exams. So a total 5 urgent response, 1 hourly monitoring, more than 7 emergency response, continuous monitoring. Now I'll give you few examples. Now this way you will find in the exam, sometime you will find this way in the exam. This I have taken from the internet only. So you can see these are the news key, because it is not the uniform charts you will find. Some parameters keep on changing. So this is the news key, what I am explaining. White is 0, yellow is 1, and amber is 2, and red is 3. Now respiration, if you can see here, they have plotted for some person. Now it is going red here, it is again going red here, again red here, and again red here. So you can see a trend. Now this is for SpO2, it is yellow or it is white only, it is fine. Now coming to the they have put the SpO2 scale also. So but for us it is not required. Coming to pulse, now pulse you can see it is 197. So this way they have plotted the chart. So one time it is going like all the time it is yellow in color, all the time it is yellow in color, sometime it is amber in color. And the consciousness level or AVPU all the time fine. So patient is alert all the time almost. Okay, Now this is the temperature is normal. You can see only one time it is falling, rest the temperature is normal only. So this way you will find news here, this way you will find it here. This is 5, this is 5. So 5 we already know, what I told just now. With the 5 what you have to do, 5 is urgent, 7 is emergency. So this is 5 urgent review, urgent review. 7 emergency review, urgent review, urgent review. This is emergency review because it is more than 7 now. 9 has there. So it is like this way the muse you will find in the exam. So in the exam you will find this way, and in the exam you will find this way. So just look the trend of the parameter or look at the news chart, then you will be able to find out whether your patient is urgent or emergency. Now this is from the Lisa Joyle's book, and now you can see it is given in the Lisa Joyle's book. So you can see respiratory rate, it is not that clear, but you see the trend of respiration, it is going towards red zone. Okay, so respiration is increasing. Now see the SpO2 trend, SpO2 is falling. So SpO2 is falling, and if you see temperature is also falling, and blood pressure is it is okay, it is okay, but no blood pressure in the red. It is coming towards fall, but it is not very low, and heart rate is rising. Okay, so this way you can see the trend, and you can see here the total news score is given 577 7 that means emergency respond. Now here I can see 10 or whatever, here it is 15. Now you can see so much high news score is there. So actually this is a chart of a patient who developed who was admitted with the pain in abdomen, and when the scan was done she has tubo ovarian abscess. So now this way so this is a picture of sort of a sepsis only. In sepsis respiration rate usually rises, and temperature can rise or can fall, blood pressure almost remains same, heart rate can rise. Okay, so this usually giving so this way you have to do the analysis of a trend. Usually in the exam you will find either it is hemorrhage, sometime you will find sepsis. So if you are able to see the trend of parameters, you are able to see yellow and red boxes, and you are able to see news score down, then you will be able to do the interpretation again. So this is the last example, and this is drawn by me only. So now you can see it, this is the this is the patient, post operative hysterectomy patient. Okay, post operative hysterectomy patient. Now you can see respiration is going fine, only one dip is there. So that is a, one yellow is fine. Now SpO2 is almost fine, yellow white, it is always white, no problem. Now you come here to the blood pressure. The blood pressure you can just, if you can look it from very behind also, you can see almost the blood pressure is very low, 46, 45, 50, 48, and upper is 94 to 94 to 40. So all the time the blood pressure is in red, and it is in the lower side, so blood pressure is falling. Now you see the pulse rate, the previously the pulse was fine only, now it is started rising. So there is hypotension and tachycardia, and the patient is alert all the time, there is no problem in her consciousness, and the temperature is almost fine, white score. Okay, almost it is the white. So though okay, so this way now looking at the trend, what do you think, what could be the possibility? So can you tell what is the possibility?
Yeah, because blood pressure is falling and heart rate is increasing, so maybe the maybe internal hemorrhage.
Yes. So answer is internal hemorrhage.
Yeah.
Post-operative patient and blood pressure falling, and the heart rate rising. So answer will be hemorrhage. So only this much like I have to say about this, and because people when they have questions in part 2 and part 3, they get scared when they see this kind of graphs and chart. Because of that, I have put this small short class for explaining MEOWS and NEOWS chart. Hope that helps you. Thank you for joining. Any question?
No.
Okay.
In the
Okay,
exam,
then.
actually, the graph, well, we will see, because the face to face, we will able to see maybe properly.
Yeah, you will see in
Yeah.
the
Yeah.
whether it is an online exam or whether it is an offline exam, you will find this kind of MEOs in the
Mm,
exam.
mm,
So
mm,
either you will find NEO score there, they will write
mm,
score there, so you know how the escalation according to the score is done. And if the score is not written, like I didn't write any score here, so
mm.
you see the trend. Looking at the
Yeah,
trend,
trend, yeah. So
you will
why
be
it is
able
going
to do it.
into red? Huh?
Yes. So this way, now it is very easy, and people
Mm,
they get scared when they see, okay, how I will do the interpretation of me news chart, but it is easy. And if you like this way, I think if any of the news chart will come, you'll be able to handle it within a 5 or 10 second. You'll be able to do the interpretation, because when the post op stations usually coming, you will find 4 or 5 pages. So
yeah.
assessment from the muse is very important, because that will help giving a clue to your
Clue,
diagnosis.
yeah. At a glance.
Yes, just look at
Mm,
it and you'll be able to find, okay, this is the trend. So
mm,
yes, I'm dealing with the hemorrhage, or I'm dealing with the sepsis.
mm,
Okay,
yeah.
yeah, that's all
Mm,
about it. So
okay.
okay, thank you for
Thank
joining.
you. Thank you. It's clear now.